Good afternoon. I hope over the last few days all of you were able to get outside and enjoy the warm, nice weather that we had before this new cold spell. We came out of winter, we'll go back into it, and then we'll come back out again and it'll be a nice spring. By this time, everyone has been impacted by COVID-19. I want to give a shout out to my old squadron mate, Luby, who started me on the beer challenge as he sits through a 14-day quarantine over COVID-19. I also wanted to send my thoughts and prayers to Lindsay, the daughter of another old squadron buddy of mine. She's been fighting in the hospital with a fever for over a week that has spiked as high as 106. While she has tested COVID negative, she has been all alone because of this COVID virus. I can't even imagine fighting this in isolation. Lindsay, stay strong. We're behind you and we're with you. Aside from the illness itself, COVID-19 is causing a lot of people to be in isolation. Please remember that and go talk to your grandparents, your parents, your older neighbors. Talk to them through the screen, talk to them electronically, use Skype, use Facebook, use all the electronic tools we have so that they aren't isolated through this time. I also wanted to give everyone an update on the existing situation of the cases that we have as well as the projection models that are out there. On Tuesday, Illinois had 12,942 cases and 307 deaths. Today, that number stands at 15,078 cases with 462 deaths. Remember, we expected this and this increase is actually less than what we expected. On Tuesday, there were 61 cases in Orland Park. Now, there are 70. And suburban Cook County has 3,936 cases. On Tuesday, I spoke about modeling from the University of Washington that both the White House and the state of Illinois uses. On April 1st, the most likely case model projected a peak on April 20th, with 10,944 beds being used, 1,638 ICU beds, and 1,311 ventilators needed. On April 5th, this model changed to peaking on April 15th, with 9,844 beds, 1,838 ICU beds, and 1,575 ventilators needed. What I said at the time was that while this has been projecting deaths relatively well, the model was over-projecting the number of resources we needed from hospital beds, ICUs, and ventilators by almost double. That was good news that what we were doing was working. The latest modeling that came out yesterday, with the latest information put into it, lowered these projections. It now shows that Illinois will peak on April 11th, 2 days from now, with needing only 3,762 beds, 710 ICU beds, and 604 ventilators. It also cut the expected death toll in Illinois from over 3,000 people to 1,588. This is great news if this continues to hold. The efforts of Americans, Illinoisans, and Orland Parkers have helped to make this happen. I think it also shows that the warmer weather, people getting outside and not being stuck inside where the disease stays and the viruses stay in a small space and gets more dispersed, has helped. This tracks very similarly to other respiratory illnesses that we've seen year after year that start to die off in the spring and into the summer when people start to get outside. This does not mean to stop doing what we're doing. It means the opposite. It means to keep what we're doing so that this awful virus goes away. It's still okay to go out for essential business that you have to do. It's still okay to go out for walks, to go out for exercise. Just please maintain a social distance, enjoy the fresh air, and make every effort to follow all the hygiene practices and social distancing that's required. This also means that sooner rather than later, we will begin to lift some of these restrictions. I want to strongly remind you that when we lift these, to continue to follow social distancing and the hygiene recommendations, or else it's likely that we will end up closing things back down, which none of us wants to happen. I can assure you that the village staff, most of the village board, and I have been working diligently on our plans for when the restrictions are lifted. We want to help the village recover as quickly as possible to benefit both the businesses and the residents. I look forward to making these announcements soon, but we will not make these announcements until we know that these restrictions have been lifted. In the meantime, we continue to look for volunteers that can help small businesses apply for the CARES Act that they qualify for. Please contact Jennifer Peterson at jpeterson@orlandpark.org to volunteer. If you are a small business in need of help, also reach out to Jennifer as she will be able to put you in contact with these volunteers. Additionally, we have implemented a Masks for Medical program. Since many of our medical professionals cannot get masks from the Illinois Department of Health or the Cook County Department of Health, we stepped in to help. We ordered masks in bulk so that these businesses can get what they need. All we ask for is that they cover our costs for the mask, which is $3.75 each. Our first shipment should arrive tomorrow, and currently we already have requests for over 500 masks. This is an example of the village stepping in to solve a problem and avoiding the red tape that we would have to deal with at the state level or at the county level. We are here to help. Please continue to give us your ideas and let us know about your issues. We won't be able to implement all of your ideas or solve all of your issues or problems. However, the ideas that we can implement, we will. The issues we can solve, we will. What we have been doing is working. Please keep doing what you're doing. We need to take this seriously, but we don't need to be afraid. Follow the social distancing requirements, follow the hygiene recommendations that have been asked of you, and we will get through this. The end is near, but we don't want it to slip out of our grasp when we stop doing the things that we've been doing to get here. Continue to stay home and stay safe. Thank you and good afternoon.